We offer it. We suggest to them that they can get it, but they're unionized, and we can't just mandate that they all go get a vaccine
Could you explain why you can't mandate, why they have to get a vaccine?
because they're union,
Okay.
and the union said no.
Okay, all right, perfect, appreciate it.
Question. Yes,
Yes,
Mr.
Victor.
Valier, what are you advising your patients that have taken the vaccine around January? You know, we were told early on that maybe 6 months to, 8 months, 9 months, we maybe have to take a booster shot this fall. The ones that have taken their vaccination late December, January, what are we advising them?
As of this morning, Dr. Lang and I had visited about that, and there hasn't been anything different come out about that. There hadn't been any guidance from the agency on that, or that we've seen from, or that he's let me know about. So right now, we're not advising anything yet.
Okay, all right. Thank you very much, Madam Chair.
Anyone else with any questions? Councilor Buzzard.
George, what type of vaccines are you giving there at Claremore? Like Pfizer, Moderna, and then the Johnson & Johnson? Do you do all three, or do you have a choice of
No, sir. Right now, we're back to just the Pfizer.
just the Pfizer? Okay. What about, to your knowledge, have you had any reactions to some of those vaccines that's come through your clinic?
Nothing adverse. We've had some sore arms. My arms got sore, but for a couple of days. But that's about the extent that's made it up to me.
Okay. All right. Thank you, sir.
You're welcome.
Thank you.
Anyone else with any questions? Well, I think that's it. So
Thank you.
thank you so much for driving down. It's good to see you today.
My pleasure. Good to see you guys. Thank you.
Thank you. Okay, Dr. Stephen Jones, you're up. Good afternoon, Dr. Jones. How are things going up at, in our health system?
Well, good afternoon. Thanks for having me. Let me get my notes out here. All right. Your report is in your packet. I'm not going to go through and bore you with all the same stuff that we look at each time, but if there's any questions, I'd be glad to answer any questions about the report. A couple of things I do want to bring up. Councilor Buzzard, you'd asked me about behavioral health staff last time, so I want to answer that question for you. We have 141 total staff. 47 of those are providers. Okay. And then the other thing, I'll give you an update on our vaccine, where we're at with our vaccine. We've done over 60,000 vaccines to date. We have opened up the Pfizer vaccine for 12 to 15. We have done some external operations. We've done the Hard Rock and Tulsa. We went to Siloam Springs, and we also went to the Roland area with some external efforts. The Pfizer for 12 to 15 is available at all of our clinics now, starting tomorrow. The clinics that have Pfizer are Muskogee, Tahlequah, Veneta, and Sallisaw. Starting tomorrow, we will be transporting some vaccine to each of the other clinics for Tuesday, Wednesday, and Thursday, and that gives us time to get the vaccine back to the bigger clinics on Friday and use it once we've opened a vial. So that is the Pfizer vaccine, which is very difficult to handle logistically. So we have to make some accommodations, and we can't have it there 5 days a week, but we will be able to have it 3 days. So Tuesday, Wednesday, and Thursday. And if all possible, please encourage your constituents to make an appointment. It's easier for us to handle that vaccine when we have an appointment and we know that someone's coming in rather than walk in. So we have been getting a lot of questions, and I'm sure you have too, about dental. We are still testing all of our patients as they come in for dental appointments with the Binax test, so we get it immediately. And that's to protect other patients and our staff. because in the dental world, we do create a lot of aerosols, and that is very, the part that makes the COVID very contagious. So we want to make sure that we're keeping our staff and our other patients safe at this time. Other than that, I'll entertain any questions.
Counselor Deere.
I was just wondering, you said that was appointment only for the youth at the facilities?
It is walk-in, but it's a little easier for us to manage it if we
Okay.
have an appointment. We are working through our pediatric providers also to get as many people vaccinated as want to be vaccinated. So we are working off a walk-in type system, but it is better for us if we know someone's coming.
Okay, and how are they going to market that to those communities?
There should be a press release going out today.
Okay, all right, thank you.
Anyone else with questions? Yes, Counselor Buzzard.
Dr. Jones, I'm just looking at the revenue report, and third-party revenue is up considerably from last year. You look down to W.W. Hastings, and it's lower. What do we attribute that to, I wonder?
Well, we moved some of our third-party revenue off of WW Hastings onto CNOC because we moved the outpatient
Okay,
services
yeah.
to the outpatient center. And then, of course, a lot of things last year had to do with telemedicine. We get much less reimbursement for telemedicine versus in-person visits. And when we converted over, a lot of our revenue went down.
Okay. What about the acronym slipped my mind. You know, where the doctor sees so many patients and they get to charge, or they get more money by having those, is RVUs?
RVUs, yeah,
Yeah.
relative value
Is that-
units, yeah.
Did that, I guess it went down during the pandemic area then?
It did, and we modified our contracts
Oh, you did?
accordingly.
Okay.
Yeah.
All right. Okay.
Yeah, we did not hold anybody to those RVU requirements that we had previously held because it wasn't possible.
Okay.
So we'll adjust that, and we reserve the right to adjust that based on the situation.
I see. Okay. Thank you, Jeff.
Counselor Legg.
Dr. Jones, do we have did we make it a rule that all of our clinic employees have to be vaccinated?
Not at this time. I mean, we are encouraging it strongly. We have a pretty high compliance rate, and I don't know the exact number. It's different at each clinic, but we are encouraging everyone, from our standpoint, to be vaccinated if it's possible.
Counselor No Fire.
I may take Chief of Staff on this, but I was looking over that because Councilor Legg asked a question about mandated vaccinations. I found an executive order that was out May 11th on vaccination requirements being mandated. So I don't know if that's something that, because I just found out about it since I just got it sent to me on the executive order for vaccination. So I didn't know if that's something that's also pertaining to all the employees over there at the healthcare, or
What's the effective date on that executive
it
order?
says it's going to come up, well, it says it's effective on signature whenever it says it was effective. It also says that there's going to be policies created no later than May 25th.
So to my knowledge, there's nothing that's mandated at this time on this date. So I can't speak to, like I said, Todd, Chief of Staff may want to speak to that, but at this time, there's not a mandated policy for vaccine.
Okay, all right. All right, thank you. I'll keep reading it into it further. Appreciate it.
Chief of Staff Enlow, would you like to address that?
Yes, thank you. There is an executive order. It doesn't become effective until May 25th. There's a lot of policies and review things that we need to review. We are encouraging our employees to become vaccinated. There are some exceptions for medical and religious reasons in there, plus any potential contradiction with any federal funding or anything like that. So those are the things that we're reviewing to make sure that we get as many employees vaccinated as we possibly can. It is not necessarily a mandate, but we are looking at incentivizing and creating a policy to get as many people vaccinated as possible.
So nobody will lose their job if they don't?
That is correct.
Okay.
There will be some elective things, so if I want to go to a training that is not absolutely mandatory for the fulfillment of my job, I may not get to go on travel if I'm unvaccinated. So there are some instances like that that are elective-based opportunities, but nobody will lose their job related to this.
Okay.
Just had a question, I was reading over it, and it does say, for Part A, all new employees shall receive full COVID-19 vaccination within 45 days of commencement of employment. Failure to do so shall result in immediate termination of employment.
That's for new employees, but no existing employees will be subject to that.
All right.
So we're
You said-
we're still working through the details. This executive order has not gone into place. We've got to get our policies and things in place. But obviously, we want to try and get as many people vaccinated as we possibly can. So we're trying to find ways to incentivize and encourage people to get vaccinated.
Yeah, okay, great. Because I'm for vaccinations. I got the vaccination whenever I had the opportunity to do so. I encourage my parents, and of course, I have my sisters who, they view things differently, and even after trying to talk to them about it, everyone has the right to view things how they want to, but I just was making sure that whenever I seen that come out, it doesn't impede any employees that we have from getting employed, because one thing, and obviously we'll know more policies before they come out on the 25th, but Cherokees in general, the people I've talked to in my district, they're apprehensive about it. They're not knowing about these things. They don't trust the government trying to force them to get something in their arm they're not aware of. It was newly rushed. I do believe in it, but that's how they feel on it. So, it's something that worries me, that we're going to have a lot of Cherokee employees here feeling the pressure of doing something that may not be something that is in their beliefs. But I do think I see that there's some things in there that they can get exempt for their religious beliefs and otherwise. So as long as we can educate them that if they still feel that way, that they don't need the shot, and also the new employees, if they are coming aboard and they have a personal belief under the religion aspect of it, to not get the shot, that they're able to afford that right not to lose their job. I'm all for trying to encourage them myself. I just hate to start segregating people based off their personal belief. So, but I appreciate it. Thank you.
So Counselor, to your point, there are a couple of exemptions in there that employees could use. One is medical necessity. We have had a few employees that are unable to take either shot or took the first shot and had a reaction, and their medical provider has suggested that they not take the second shot. So there are a couple of exemptions. We'll be working through that over the next couple of days, and we'll be formally announcing it to all the employees, as well as the policy and any incentive programs and how that's going to work. So we wanted to get this out to the executive directors, let them know that this was coming, but it hasn't become effective yet. Even though it was signed, the effective date of this will go forward on May the 25th.
And just for future on executive order, that I'm sure I probably wouldn't be alone as a counselor in making sure that we get copies of those. So we know when we start getting phone calls about an executive order that we're kind of at least made aware of what it's going to be regarding to before we get it. So I appreciate that.
Okay.
Chief of Staff Enlow, after Dr. Jones's report, would you like to share what happened, the pandemic broadcast that we did on Saturday? Would you like to share information after his report? Thank you. Okay, anyone else have any questions of Dr. Jones? I have a couple. Dr. Jones, what is the phone number or hotline to schedule an appointment for a vaccine?
Hey, it's 539-234-4099, sorry.
4099.
539-234-4099.
Thank you. I also want to ask about our contract health. In relationship to the Blue Cross and Blue Shield, no longer, I think, working with St. Francis Physicians or the medical institution itself. Will that affect us in contract health dollars?
It shouldn't affect us in contract health, but it may affect us with our health insurance that we have through Cherokee Nation. I don't know about that just for sure at this time. But through contract health, we're not dependent on Blue Cross and Blue Shield to provide that. We pay Medicare-like rates, so our negotiated rates are already there.
Are negotiated. Okay, I was just wondering, because I am aware that if you have medical insurance, you know, we utilize that to, so we have further contract dollars to help our citizens.
That is true, and we are the payer of last resort, but we do have a set fee, and from that standpoint, if we contract with someone who doesn't accept an insurance that a patient has, then yes, then that does affect us in that way.
Okay, so the other medical institutions may pick up a certain amount of our business possibly then as a
Right,
result of
yeah.
that. Okay, and I think that's all I really had to ask. Were there any other questions by council members? Am I forgetting anybody? No? Okay. Well, Dr. Jones, thank you. I want to say I'm impressed that 60,000 vaccines, because I talked to you, a week ago, and we were only at 53,000, so that's 7,000 more.
Yeah, they're doing a good job at getting anybody that wants it, and we've got to, we have the ability for people to walk in now, and we're open to any and everyone. So we have a lot of vaccine. We'd like to get it put in people's arms as quick as possible. So the quicker we get people vaccinated, the quicker we can get back to normal. So
What's the percentage on where we are toward herd immunity? Do you have any clue on that?
I don't. Our user population, we're not as far along as we'd like to be. We're somewhere between 25 and 30% of our user population. So, but no, I don't know where we're at on herd immunity.
Anyway, any
Madam
parting words of wisdom for our constituents who may be listening in?
I would just encourage everyone to get educated and get the vaccine, not listen to all the rhetoric and the politics around it, and get educated for themselves.
Thank you so much.
One
Speaker
more
Byrd.
question. Out of that 60,000, how many of those are tribal members?
I don't have that number for you off.
Did you say
right
80%?
I would say probably closer to a higher number of it for sure. Right now, we're trying to focus on how many of those members out there are, because we've kind of been excluding those adolescents between 12 and 15 to try to keep our numbers accurate for the people that are eligible for it. So our numbers are a little bit skewed right now as everybody's working through those numbers. So.
Okay, all right. Thank you, Dr. John. Thank you, Madam Chair.
Dr. Jones, will you please share with our healthcare heroes how grateful we are for all their efforts? I mean, these are people who literally put their lives on the line in their job responsibilities this year, and we're truly grateful.
Absolutely, I will do that.
Thank you so much.
Thank you.
Okay, let's bring back Chief of Staff Enlow. Chief of Staff Enlow, I thought you might want to share some words on the pandemic program that you did about our tribe over the
Yeah.
weekend.
So on Saturday, we hosted a live event called Shaлагee or Cherokee, or wherever we are. And this was the second in a series, and it was focused heavily on at-large in our response to the pandemic. And so we shared some facts and figures about the response and the things that we were doing, as well as I got to talk to Chief and Chuck Garrett from Cherokee Nation Businesses about what we were doing as a businesses and the government to respond, and how we protected employees in each of those institutions. And then talked to Dr. Beth Harp with our Cherokee Nation Healthcare System, and Mita Nix, a speaker, a teacher at the immersion school, and a veteran, about their experiences with the vaccine. So to your point in the comments raised earlier, it was trying to educate and help people understand the impact of the pandemic, and then also the impact of vaccination and what it meant to those two individuals in particular. I don't know the exact numbers at this point in time as far as participation, but it is now posted on YouTube. It's about an hour and 10 minutes long. I was a little long in my speeches, so we went a little over the hour. The other two individuals that we heard from during that were both counselors for the at-large, Counselor Shaw as well as Counselor Coates. and sharing information of trying to connect. And so a lot of our focus is trying to reach our tribal citizens outside the 240,000 that live outside the reservation boundary, and share good pertinent information with them and the stories and things that are going on inside the Cherokee Nation. So it was a very good event. I was honored to be a part of it.
I heard some lovely comments about it from some of the at-large citizens, and I think you might ought to consider being a TV talk show host, because you did a great job hosting that, I thought.
Well, if I get to say, you get a car, and you get a car, and you get a car, I might do that.
Does anyone have any questions in regard to this? Chief of Staff Inlaw? No, well, thank you very much for giving that report, and I do know that our citizens all appreciated it. Thank you.
You bet, thank you.
Okay, any old business? Any new business? Any announcements? I do have that our next meeting is tentatively scheduled for Monday, June the 14th at 1 p.m. That being said, I'll take a motion to adjourn. Okay, thank you.